Hello, welcome. Good afternoon. Thank you for joining today's webinar titled Environmental Health and Asthma, Universal Strategies for Improving Health Outcomes. Today's webinar is going to focus on how environmental conditions shape asthma treatment, the patient experience, and their health outcomes. And focus on how health centers can strengthen their role in identifying and addressing those factors. Before we begin, just a few quick housekeeping items. To support the flow of today's session and minimize background noise, everyone's been muted upon entry, but we intentionally have set this up as a meeting, and so we do appreciate during times for discussion if folks want to come off mute. If you're a person that likes to have your camera on, I would love if you want to turn your camera on. And we ask that you go ahead and use the chat if you have questions as they come up. That way we can address them. And today's webinar is being recorded and the materials will be made available. At the very end of today's session, we'll pop up a link to get your feedback and really appreciate the feedback that you provide. For accessibility, captions are available in this Zoom meeting. You can adjust or hide your captions by selecting the live transcript option at the bottom of your Zoom window. If you experience any technical issues, feel free to send a message in the chat, or you can direct message and one of us will help you out. And I'll do my best to help you remember, but as I am also facilitating, just a heads up that sometimes the quickest fix is to just log off and rejoin the meeting. And one more time, because I know when I attend these, I often ask more than once. Today's webinar is being recorded and the materials will be made available to you all. Today's webinar is part of the wonderful training and technical assistance that our national training and technical assistance partners provide. So, right, CSH is one of 22 amazing NTAPs, and we really appreciate the collaboration of our national partners that you see represented here. And as it's noted on the slide, the contents of today's session are those of your author, and they don't necessarily represent the official views of HRSA, HHS, or our U.S. government. A little bit about CSH. CSH, the NTAP firm that I work with, empowers communities to create homes and deliver services that build safe, thriving, and resilient futures. Our work supports affordable housing developers, service providers, and policymakers with tools, data, and expertise. Since 1991, CSH has invested more than $2.2 billion in communities, helping to create and in many cases preserve more than 500,000 units of supportive housing for individuals and families that have exited long-term homelessness. A little bit about me. I'm your facilitator today. My name is Austin Puka. Use she, her pronouns, and I'm a senior program manager here at CSH. I'm glad that you're here, and I hope that today's session gives you some practical, but really implementable strategies that you can take back to your teams with confidence and incorporate those strategies into your workflow. Taking a look at today's agenda here, I introduced myself, and it would be lovely if we could see who's with us today, recognizing that HRSA's Bureau of Primary Health Care funds so many thousands of health centers around the nation, and that opportunities like this, where y'all can come together and learn about strategies across the nation, are really helpful. So if in the chat you wouldn't mind adding your name, where you're located, and maybe what made you decide to register for today's webinar. Right? And after we're done reviewing our agenda, we'll move on into the core components of asthma and the treatment for core components of effective treatment and asthma management. From there, we'll spend some time discussing strategies for strengthening health center capacity, which could include screening, referral pathways, partnerships. We'll pause the recording towards the end for an open discussion and question and answers. Then we'll pop the recording back on. We'll take a look at our key takeaways, and we'll go ahead and launch that evaluation survey that I mentioned. Our learning objectives for today, right? By the end of today's session, really hopeful that folks, right, should be able to describe how environmental conditions impact asthma management and patient health outcomes. We hope to leave with a firm understanding of how screening, assessment tools, right, can help you to really identify those gaps in care and to align some meaningful improvement efforts. And then we'll wrap up by exploring how integration between health centers and some of those community-based service system providers can really strengthen coordination, close those gaps, and ultimately improve health outcomes for your patients. All right, so we'll jump in, right? We know that asthma is a chronic health condition, right? And it involves ongoing inflammation of your airways and lungs, right? Common symptoms of asthma include coughing, wheezing, shortness of breath, chest tightness, right? But one way to think of how asthma develops is really that interaction between a genetic predisposition, right? Asthma is one of those, eczema, right, to allergic diseases, and then environmental conditions and how those trigger each other, right? And environmental conditions can include viral infections, dust mites, pet dander, pollen, allergens, right? Fumes or smoke that's being inhaled, right? Or just poor ventilation in general, right? Weather can impact, right? And then other broader non-medical factors of care, right? So like a person's housing. And so we want to look more deeply at what we mean by non-medical factors and conditions, right? Non-medical factors and conditions in a person's environment are really vital to their health outcomes. So for asthma, we can think about environmental conditions as part of that broader set of non-medical factors that affect health, right? Those can include economic stability, right? Social and community environments, built environments, right, and access to care and education. When we think about like economic stability and how that environmental condition might affect someone, right? If we're prescribing medications to our patients that maybe they cannot afford them fully, right? If there are things around poor ventilation and they can't afford to make those accommodations to their homes, right? We think about community or social environments, right? Where do we spend our time when we're out being social with folks? Where do we work, right? I have friends that are welders, right? And so that their built environments for work, may put them at an increased exposure to some of those non-medical factors and conditions that really adversely impact a patient's treatment in asthma care. And so when we recognize all these factors and then we work to address, when we think about how do we address them, right, that often really does require some action across sectors, right? That can include public health, it can include transportation, education, housing, healthcare, and community agencies, right? But recognizing that it's a community lift. And our session is really going to dive into what does that community lift look like, right? So as we move through today's discussion, I really want us to keep access to healthcare and education at the forefronts of our mind, recognizing, right, that health literacy is really central to a patient-focused approach, right? And that personal health literacy, right, is really about whether the individual can find, understand, and then use the information and services, right? And can make an informed decision about their uh, an informed health related decision. Similarly, right, in order to do that, our organizations need to be set up in a way that makes that possible. So when we think about organizational health literacy, that's really about whether our organizations are making it easier for folks to do that, right? Is information easy for people to access and understand? Are they able to use what they're receiving from us, right? That can sometimes mean really ensuring that our staff is knowledgeable, whether that's increasing some trainings or having folks join today like they are today, right? Working through workflows, looking at our assessment tools, and the ways that we are communicating with folks across sectors and in our communities. All right, so jumping off right into how do we effectively manage asthma, right? And it includes, like effective asthma management, includes four major components, right? So assessment monitoring, pharmacological therapy, right? Patient education and self-management, and then that environmental trigger control and comorbidity management. Today's focus, right, we're really going to hone in on how those environmental conditions and factors connect to all four of these components and what we can do within our health centers to build capacity and respond to those needs. All right, so, right, and then when we think about those four components, we start with assessment and monitoring. Assessment helps us to define the nature of the problem and guide our treatment recommendations and plans, right? So quality asthma care would include that initial diagnosis, right? And coming to treatment to like a treat control, right? To reduce inflammation, and then to build a long-term follow-up plan. And knowing that the overall goals are to reduce impairment and reduce risk, right? So reducing impairment, right, would mean improving your patient's day-to-day experience, want to reduce symptoms in ways that support their normal daily activities of living, right? We want to reduce risk. We really want to think about preventing someone from having an asthma attack. We want to help folks avoid emergency care hospitalization, right? We want to be focused on how do our treatments and the interventions we're using with patients, how are we protecting their overall lung function and minimizing any side effects they might be experiencing from their medications. So, right, things like staff training is really essential to ensuring that care teams really do understand the why behind these three components of that quality asthma care, right? Understand the why behind the assessment tools that we use and the why behind the processes and ways that we follow up with patients. Right. So we've assessed folks, and now we're reviewing that assessment and we're thinking about what are these environmental factors and their impact potentially to our treatment. Right. So environmental factors can really they can impact your medication, right? They can make medication seem less effective, or they can even overpower your treatment to begin with, right? When patients are exposed to triggers every day, such as mold, pests, smoke, fumes, right, or experiencing all of that and in a poorly ventilated area, their airways really do and can remain irritated and inflamed, right? That can impact a person's rescue inhaler from providing the relief that the patient expects it should provide, right? It can impact controller medications, right? Not being able to compensate for the ongoing exposure that someone may be experiencing in their environment. And really, when you put those together, it can lead to more frequent symptoms, right? It can lead to more frequent emergency department visits. It can require that our patients are needing additional steroid bursts to calm inflammation, right? And ultimately, it can lead to provide some inaccurate assumptions on the provider side that perhaps like your patient isn't adhering to treatment. Right? So asking about a person's home and the broader environment that they are living in helps us to avoid mislabeling patients and to better understand what is really affecting their control so that we can really tailor our interventions. Patient education and self-management. Right? Our patients aren't with us every single day. They come to their appointments, they come to their follow-up, but largely they're out in the world self-managing based on what the information and education we've given them. So self-management refers to the day-to-day tasks a person takes, right, that they take on to live with one or more of their chronic conditions. And for asthma, self-management it's most effective when the patient has a written action plan. And so what you're seeing here is an example of an action of uh, and it's a template that you can also download. So when you get these slides, you will be able to click on these links and reference them. Right? But the overarching importance, right, is that a personalized asthma action plan really helps the patient understand what to do when their symptoms change, right? When to use their medications and when to seek help, right? And how to recognize triggers that may be making their symptoms worse. Right? So y'all are all coming here, right, to increase y'all's knowledge of environmental triggers, right? Hopefully by the end of the session, you will find areas where you might want to, make some improvements on tools you're already using so that patients can more readily recognize if triggers are adversely impacting their treatment and know how to relay that information back to you. And so thinking further about supporting patients and their self-management, when we talk about environmental screening, right, it's important to consider what your patient's going to be going through in that screening, right? Some folks might not realize that their home, right, their work life, or their social environments that they enjoy to participate in are affecting their asthma. Right? Folks may also feel embarrassed or worried about being judged if they mention pests or mold or overcrowding or smoke exposure, right? And so some may know that there is a problem, but feel sort of helpless or powerless to fix it, right? And we talked in previous slides about, right, things that can, the different factors, right, such as economic stability, right? And there may be folks that, right, if they have they're renting, right, they might be worried about retaliation, right? Or you might have families that are really juggling multiple stressors, right? So our goal overall as providers and like throughout this training uh, is to recognize our role in empowering our patients, not blaming them, right? And that our goal is solutions, not stigma, right? And that screening should really open the door to support patients, right? To support their education, to support meaningful referrals and practical solutions that make sense for your patient in their life. So, right, effective asthma management might include, right, symptom tracking, lung functioning tests. We love the aspirator. Can we keep the ball floating, controller and reliever medications, personalized asthma action plans that we talked about, right? And supporting people through their techniques with using their inhalers, right? And then just an overall understanding of their triggers so that we can support avoiding them, right? Ineffective treatment plans, right, can kind of show up or present when we notice that a patient is remaining symptomatic despite reporting and recognizing that they're adherent to medication, right? Symptoms might increase despite efforts around education, despite a patient's self-management efforts, right? Or we might just have assessment protocols that do not screen for environmental factors, and so we're missing that they are playing a role at all. So in these cases, the treatment plan really could be missing a key part of your patient's reality, right? Which then means you're in turn are missing a key part of developing effective plans with them. So I would love if we could start and just know based on who we have here, right? Does your health center currently screen or assess patients for environmental conditions, right? And some of y'all might say, yeah, we're doing that already. Some may be unsure. I never thought about that before. Go ask someone, and some folks might not be screening at all, and you know that. And as y'all are answering, that way we can share information in the chat and with each other. If you do screen, is there a particular tool that y'all use? Did you develop it locally, or is it like a validated instrument? And if you don't screen, maybe even by a way of a thumbs up, or you were unsure of the answer, would you know who within your health center to talk to about getting an answer or potentially implementing some screening? Looks like we got it. The majority of folks are implementing some screening that is particular that captures information about environmental conditions. And we have some folks that are maybe one person's a little unsure. So, and I'm seeing if anyone's adding in the chat of the yeses in our shared group today. Some of y'all would put information in the chat about how you're doing that. That would be great. All right. Why do we take that poll, right? Environmental screening questions really help us to identify the barriers to a person's asthma control, right? And avoid unnecessary medication escalation, right? Um, if if someone were to perceive like this medicine's not working, but we haven't really captured if an environmental trigger is like antithetical to that medication working, right? So, right? Gathering that information lets us be aware of the necessity of shifting treatment. It allows us to tailor care plans more effectively and to really understand why a person's symptoms may be persisting despite all of those best efforts. Right? And screening questions aren't just about collecting information. Right? They also help us ensure that our treatment plans are patient focused, right? But for those that there may be folks in here that went to nursing school or, medical assistant school, and we do learn about our plans are only as effective as the person that needs to implement them, right? So screening and effective screening really helps you to include interventions that are going to respond to the actual need, not just your like theoretical need. All right, so well, let's really talk about what we mean when we say environmental conditions, right? And so those refer to a person's quality, like the quality and state of a person's environment, right? So that can include water quality, air quality, right? Weather, noise pollution, proximity to hazardous waste, exposure to harmful materials. And it will be great now to kind of think about, right? Also add this to the chat. What are patients that we're serving? Like, what might the quality and state of their day-to-days look like, right? When we look at water quality, right? We can think locally where we are. What's that like? We think about air quality. I mean, I can think right now we have some pretty significant fires happening, and so there are parts of our nation where that air quality is probably significantly affected. And I would imagine that folks living with asthma, may be experiencing some triggered or increased symptoms. And we think of noise pollution. Uh, as an example, I'm based in Arizona and I live pretty near an Air Force base, right? So you got jets taking off all night. Similarly, the Air Force Base does put folks near it exposed to PFAS, right? And so, right, when we look through these different environmental conditions, we can recognize just by virtue of like living, a person might be exposed to them. So I thought it would be kind of nice to take a moment and in the chat, right? When you think about your patients, like where do they live within your community? Thinking, are any of these environmental conditions impacted by where they may live, right? Where do they work, right? Are folks working positions maybe somewhat similar to yours where they are able to be indoors in some sort of a controlled environment that they may have some control over being exposed to fumes? Or do we have folks that might be laborers or, mechanics or work in painters, right? In environments where they're going to be persistently exposed, right? And what do they do when they're outside of the clinic, right? Folks don't just wake up, go to sleep, come see you, right? You have folks that might have hobbies that they participate in, that may, without them even recognizing, have triggers, that are impacting them. Folks may be volunteering for humane societies and not realize that they may have an allergy to pet dander, right? So really thinking of these questions and why I'm just sort of offering examples is that those are the things that help us understand the environment where the treatment plans we're developing need to succeed, right? The treatment plan that you make for someone that's indoors and has great ventilation might not be as successful for someone with a completely different environmental experience, right? Ah, that is real. Diesel exhaust, grass pollen, and molds. So it's a big experience in Benton County. And I'm in Arizona. I'm in Tucson. Grass pollen. I wish I miss grass, right? So John kind of got us started off, right? I'm really curious to know which environmental factors are impacting all of your patients the most. And so that is popped up right now. It should be accessible for folks. We see like viral infections, right? Exposure to dust, right? Mites or other pests, right? And as folks are filling that out, right? All right. Right. As folks are filling that out, right? We want to be thinking about the follow-up part, right? How can our treatment plans include appropriate intervention for the environmental factors that we're seeing, right? And the second half of our discussion is really going to lean on the experience that y'all are having. So I'm looking, it looks like, okay, folks are still answering. Yeah. Environmental allergens are happening all over for us. We had a good amount of folks that have patients that have some exposure. Thank you. All right, y'all, if you see there are some things that are kind of neck and neck, but really it looks like environmental allergens, we're all kind of going through it there, right? And then we have a good amount of folks that are exposed to smoke and have some poor ventilation. Yes, that wild oil refineries. I appreciate you lifting that, Fatima. Locally, we have it's a mining community in some parts of Arizona, and so that's a great one to add. And wildfire smoke, I almost like that sweeps the nation, depending on where you are. Yeah, right. Appreciate y'all taking the time to share with each other. All right, so in the clinical setting, environmental triggers, right, could show up as dry coughing, persistent symptoms, right? Folks might complain of nighttime waking, right? They may report that their symptoms are worsened by smoke or strong odors, right? And that's why a lot of our offices probably ask folks to not wear perfume, right? But it's especially important when we are thinking, right, about those non-medical factors, right? And so, right, that could include some of your patients that may be homeless, right? Or folks that may be living in places that are not necessarily meant for human habitation, and where their risk to exposure may be higher. And so, like, when we're looking through those poll responses, right, we really wanted to think about and notice which triggers participants recognize popping up the most, and how could those then be incorporated? How could you think about incorporating them into consideration as you're adjusting treatment plans while you're thinking of referrals that might support your patients and that ongoing follow-up? Right, as an example, when we think about like exposure to other pests, right? And we're thinking about non-medical factors and folks that may be living in places that aren't necessarily meant for human habitation. We think probably about cockroaches, right? And so a cockroach allergen, their allergens can be found in their saliva, in their feces, and in their actual exoskeleton, which can cause folks to have like an allergic reaction to any of those components. And it would mimic and seem pretty similar to the response that folks have when they're allergic to pet or a cat dander, right? And so recognizing that, I personally, until I researched that, did not know that a cockroach has a similar experience that someone would have to pet dander, right? And so you might be missing that someone's symptoms are exacerbated by this particular area. And you may be thinking they're working inside and they're taking all their medications, but you never boil down to what sorts of pests may be in their environment, right? And similarly, when we think about folks who are living in inner city, right? We often talk about rural conditions, but inner city conditions, right, may lead to sensitization, right? We had folks mention weather in the chat, right? Extreme weather, very hot, very cold, and humid can exacerbate folks' symptoms, right? Wind and wet weather can disperse pollen and mold, making it worse, right? And then, as John pointed out, natural disasters such as wildfires, right? And all of these examples do show a correlation of increased rates of asthma exacerbation. Okay, now we want to get into the good stuff. How do we connect environmental screening to our treatment planning, right? So this is another poll we got coming on, right? I think it's our final poll before we do evaluations. right? So how does your health center ensure that your treatment plans include appropriate interventions for known environmental conditions? And maybe this one, yeah, should be a poll. Let's see. There we go. Right. So when there were, we had what, like 80 something percent of folks say that they are screening, right? And so what does your treatment plan do with that, right? Does the treatment plan take into consideration those environmental conditions? Does your treatment plan reference them, but doesn't necessarily address or solve for them, right? Or do your plans enable patients to take what they've learned and identify services that might be able to alleviate some of their concerns? And are you not quite sure? Because that's real too, right? Some answers rolling in. Oh, hey, right now well, there we go. Okay. Y'all saw me trying to do math in my head to see if we have all our responses coming in yet. Hey, folks are still working there. I think what I noticed so far, and we haven't ended the poll yet, I'm still giving folks time, but no one has mentioned that their treatment plans just absolutely do not cover them. So I think that's great, right? We are starting with a foundation of we all agree that they're important, right? The levels at which we might be incorporating environmental conditions in our work may vary, but we all do recognize their importance. I'm going to get a few more seconds in case some other folks want to make their answers before we end this poll. Yeah. Yeah, so as you see, no one here is just completely not doing it. We have our one person who's been consistently unsure, and I appreciate it. Okay. All right. So part of asking that question is to know how do we assess where our capacity is and where we may be going, right? So the ability to strengthen your health center capacity, right, normally begins with about 5 actions, right? You want to understand what your capacity is, want to identify then, right? Develop, scale, and sustain. So first you want to understand your patient's needs, your health center gaps, what staff training might be needed, right? Once you understand it, then you want to identify, right? What existing capacity, resources, tools, non-medical, like, right, what is everything then that would connect to that? And then working through that, it helps you to identify some gaps so that you could develop some partnerships, right? Referral pathways. Maybe you update messaging to be clearer, right? But really moving from that understand, identify, and then now kind of develop a plan. Uh, and as your programs mature, right, and you've developed those plans, identified those needs, then you start to scale your work by outlining the standards, right? Uh, really leveraging those cross systems teams, those cross sectors teams, right? And then monitoring the key performance and using that information to sustain your work, right? Um, when we monitor and then review, it allows for that continuous quality improvement to, to just keep our programs effectively supporting our patients. So ways that health centers can strengthen capacity, right, include partnerships, referral, pathways, and messaging. Partnerships, right, may include federal programs, local and state agencies, community-based or faith-based programs, or even some of those non-traditional or philanthropic opportunities that aren't as restrictive, right? Referral pathways, right, should like a best practiced approach would include a standardized form, right? Warm handoffs and a mechanism for following up and tracking follow-up, right? And then the messaging component, right? Our messaging to our patients, when we think earlier, we talked about that health literacy and organizational literacy, right? Our messaging should use plain language, probably some visual aids, right? And consider how different trusted community members can help enforce that key messaging. And a helpful starting point, I think, is kind of always like assuming that patients might just have difficulty understanding health information. I don't know how many times y'all have handed someone, the flyers about an immunization and it's almost written in Greek, right? So really just starting from the perspective that some of our health information and resources not as digestible as our patients may need it to be. And then, working to design your systems in a way that's easier for everyone to use them and engage with. Right, and we've talked about so many different federal or environmental factors, and many of them, right, a health center is not necessarily the one that's going to support us with a wildfire, right? There are several federal programs that do support, right, as an example, some housing rehabilitation, if we have poor ventilation or mold, right? Repair, weatherization, and other related needs. Examples of those, what you see here on the screen, right? Resources from housing and urban development, right? Resources and abilities for public services that are funded out of other community planning development programs that HUD sponsors, right? Your home program, CDBG, CSBG, right? Housing opportunity for persons with AIDS program, right? When we think about habitability standards, right? HOPO programs require not just a smoke detector, they also require carbon monoxide, right? And may have resources to do some of those remediation that a health center does not resourced to do, right? You also, you'll all get this back, including the links to these programs. But USDA has a whole program just for family housing repair, right? So really recognizing, right, that key point is recognizing that the health centers don't need to become like a housing repair expert or emergency management experts, right? Rather, what is the key takeaway is that you need to know who those partners are in your community and how to connect either as an organization with them and build a partnership, or how you would connect a patient to those programs or community-based services that does have the ability and resource to address those factors. Right? Right. Health centers, they cannot address environmental factors alone, right? Clinics can identify risks, but they usually cannot fix mold pests, right? They can't ensure or address unsafe housing conditions like completely directly without recognizing what partners are in their community. And I really appreciate John highlighting that Medicaid 1115 waiver, right? And there are a good amount of states in our nation that are working through those waivers, mine included, that do support with some of those health-related social needs and some of those non-medical factors. So thank you, John. And for giving us an example of how Oregon is meeting the need of its patients. Okay. And John's just helping hammer home for us how important our community partners can be in our efforts to really provide a holistic person-focused care to our patients, right? Mentioning the the Healthy Homes program, right? Which supports weatherization agencies, housing authorities, legal aid organizations, right? And local nonprofits. So we list these examples so that for some of our folks that are feeling unsure, or folks that were, kind of in the middle, you take this information home, process it, and connect with some of your peers. They may have some of the answers that you don't, or might be interested in helping to go identify those community partners and build those relationships. Right? Recognizing that meaningful integration between these community partners, including, right, how do you coordinate with providers to implement your 1115 waiver, right? That meaningful integration means having a clear pathway, right? So that the clinical staff know what to do after identifying a concern and can really support families accessing what's available to them even faster. All right, y'all. We're about to start the portion where we start to wrap it up and y'all have space to talk with each other. So this is where I would really like to pause the recording and to give folks, if they would so like, an opportunity to just discuss out loud any of the work that they're already implementing, or if there's a change that you think might be meaningful for your community after, attending today's session, share it with the group. I do it like this. Oh, no, that's the wrong button. Listen. All right. Right. Well, I really appreciate the dialogue that's been shared in the chat, folks that came off mute, added their feedback. And now we're just going to wrap up with our evaluation survey, right? And as y'all are completing that, right, we just want to remember the key takeaways from today, right? Is that our environmental factors really do significantly impact the treatment that our patients receive and their health outcomes. That importance of screening as being like a really simple but effective way to support those health outcomes. And I would say ultimately the importance of meaningful partnerships, right? Which can extend outreach, right, within our health centers to our community and really improve our patients' outcomes. So I really appreciate if we could, before everyone logs off and leaves, maybe go through and fill out that survey. And if you were not satisfied, please let us know. We really do use this information to improve future work that we create. Well, I'm going to leave the poll up while I just take you through my final 2 slides. The resources that were discussed throughout the session are all linked in here, so you don't have to hunt for them. Right, so this slide deck and the recording will be made available. And I really just appreciate y'all for joining today's session. And as a person who lives with asthma herself, I really appreciate the support that you provide in your communities. And if you have any follow-up questions or you want to learn more, there's where you can visit us. And please stay in touch and feel free to reach out. And if you already filled out this evaluation, I hope you enjoy the rest of your day. And if you haven't, please fill it out. And I also hope you enjoy the rest of your day. Thank you all. See you in the future.